You'll hopefully have read about me on the programme. My name's Shireen Kassam. My day job is as a consultant haematologist at King's College Hospital, but a lot of my time outside of the NHS is spent on promoting education and advocacy on healthy plant-based diets as one of the major solutions to not only the climate crisis, but the crisis that we're facing in healthcare, the ecological crisis. And today that's what I'm going to talk about, and I hope I'll be able to call you all to action and get you all ready for the amazing plant-based meal that we're going to enjoy at lunchtime. So outside of the NHS, as I say, I spend time as founder and director of Plant-Based Health Professionals UK, an organisation that is dedicated to providing education on healthy plant-based diets. And we're also a member organisation of the UK Health Alliance on Climate Change, recognising that a really important aspect of our action against the climate crisis is shifting the food system. And I provide education on this at Winchester University, and I'll come back to that at the end. And always good to declare one's diet pattern when you're talking about dietary patterns, and I've been vegan since 2013. So, what I'm going to discuss today is the evidence supporting plant-based diets for personal and planetary health, understand the international consensus on diet, nutrition and health, and hopefully call you all to action by the end. So why are we talking about this? Well, you as an audience will know that our food system is a direct driver of a number of our interrelated crises. We've heard a lot about climate crisis already this morning. I have not heard the mention about food system change and changing the food in the NHS, so hopefully this will start a dialogue. We are in the 6th mass extinction event. We're losing more plant and animal species at rates unprecedented. We are facing a health crisis. More and more people are spending their last decade of life in ill health. And we have a crisis of ethics, whereby we slaughter over 80 billion land animals every year. Let me say that again. 8 billion people on this planet slaughter 80 billion land animals, more than 1 trillion fish, for a food that I will persuade you that we do not need. And an article I wrote on World Poultry Day, to me World Poultry Day reminds me that we slaughter 50 billion chickens for food every year. So why is it so important to be recognising the food system in today's event? Well, animal agriculture is the leading driver of climate crisis. It is the leading cause of species extinction, ocean dead zones, water pollution, habitat destruction. We heard from Hugh Montgomery about the Amazon being destroyed, but we didn't hear the mention that 91% of that destruction is because we are demanding animals for food. It's being cleared to grow grain, to feed our animals, and to graze animals. 70% of farmland in the UK is dedicated to raising animals for us to eat, when for health we know we need to be centering our diets around healthy plant foods. And this shows it again. You can see in the graph on the right hand side that the x-axis shows the carbon emissions from the food that we eat, and at the top is listed all of the animal products. At the bottom, the lowest environmental impact is every single plant food you can think of. Regardless of the way we produce it, how we transport it, every choice you make to consume a plant-based product has significantly less carbon footprint than any single animal food, regardless of how you produce and transport it. However, as I say, most of our resources are going to raising animals for food, yet on a global level, this animal food only supplies us with 18% of calories and 37% of protein. So something is very wrong. And we cannot spend this day without mentioning the associated crisis of antibiotic resistance. This paper published just earlier this year shows that the trajectory is completely in the wrong direction. We are now losing 1.3 million people globally to antibiotic-resistant infections. That makes this condition the 12th leading cause of death. It kills more people than HIV infection and malaria, and 70% of antibiotics that we use on this planet are given to animals raised for food. Without them, we would not be able to sustain factory farming in the squalid conditions that these animals have to live their lives. And we've heard about the IPCC report. The Working Group 2 report just published is all doom and gloom. We have less than a decade to change the trajectory. However, it puts the food system centre of the plans to change this trajectory. The single most impactful action we can all take as individuals is to change the food we eat. In the report, it states, reduction of excess meat consumption is among the most effective measures to mitigate greenhouse gas emissions, with a high potential for environmental health, food security, biodiversity, and animal welfare co-benefits. And again, we want to stay within now probably the target of less than 2 degrees centigrade of warming. However, this paper in Science from 2000, 2 years ago, clearly states that without changing the food system, we cannot meet any of these targets. Even if fossil fuels emissions were eliminated immediately, emissions from the global food system alone would make it impossible to limit warming to 1.5 degrees and difficult enough to realise the target of 2%. We have to change the way we produce food. But as health professionals, we are looking after people with chronic ill health. Much of that is preventable. And we are at a state now, according to the Global Nutrition Report of 2021, where our global food system is responsible for 1 in 4 deaths. That's 1 in 4 deaths that occur globally. And in Europe, 31% of deaths are due to an unhealthy diet. And in addition, as we've heard, the food system is creating 35% of all greenhouse gas emissions. More than 50% of that comes from raising and consuming animals for food. Back in 2019, we had an in-depth analysis from the Global Burden of Disease Study Group looking at dietary risk factors from 195 regions around the world. At that time, only 1 in 4 premature deaths, were caused by an unhealthy diet. And that has only got worse. But in-depth detail showed us that the key dietary risk factors were diets high in sodium, which is of course a reflection of our reliance on pre-prepared and packaged foods. And in the UK, more than 50% of what we put into our shopping basket is classified as ultra-processed food. But second and third and fourth and fifth to that is the fact that we are not consuming enough healthy plant foods. That's whole grains, fruits, nuts and seeds, legumes and vegetables. And this is leading to excess death and chronic illness from cardiovascular disease, type 2 diabetes and cancer. And this problem has been further highlighted during the pandemic. It was quite clear that people with underlying health conditions fared worse and had a much higher risk of dying from the pandemic virus. On the left-hand side is the report from the 17 million GP health records analysed by the Open Safely study that showed that in the first wave, 90% of people who died from COVID-19 had an underlying health condition. On the right-hand side, you can see an analysis from the US, 1 million people admitted to hospital for COVID-19. 60% of those admissions could have been prevented if these individuals did not have 4 conditions: hypertension, heart failure, obesity, and type 2 diabetes. These conditions are eminently preventable through a diet and lifestyle approach. So what is a healthy diet for humans and for the planet? Well, the work has been done for us. 2019, the Eat Lancet Commission published their Planetary Health Plate. They brought together 37 scientists from 16 countries around the world to devise a diet that not only was healthy for us, but would keep the food system within planetary boundaries, boundaries that we've already breached. And here it is. You can see that half the plate is dedicated to fruits and vegetables, around a quarter whole grains. The green here is plant-derived protein. There's unsaturated fatty acids from plant sources, limited sugar. And then you can see here that a small portion is giving you an allowance to continue eating animal foods. But it clearly says we do not need animal products in the diet to make it healthy. certainly for sustainability, we should eliminate all animal products if we can. But if you choose to continue to eat, it should be less than 13.5% of your energy or calories on a daily basis. This amounts on the right-hand side to 1 portion of red meat, less than 100 grams, 2 portions of poultry, and around 3 eggs per week. And this is put into a graphical form here using data from the most extensive analysis, farm-to-fork analysis of the environmental impact of food, published by Joseph Poore in the journal Science in 2018. And you can see encircled in green are the foods that not only promote our personal health, but have the lowest environmental impact. And they are fruits, vegetables, whole grains, beans, nuts and seeds. And we have to remind ourselves that if everyone on this planet ate like people in the UK, we would need 7 planets to feed the world. This paper, published just a few weeks ago, analyses the co-benefits for personal health and planetary health in a prospective cohort study. So the EPIC study has nearly 500,000 participants from 10 European countries, followed for around 14 years. And they assessed the impact of the Eat Lancet Planetary Health Plate and what that would mean for personal health. And what it would mean is if we were adhering as best we could to those guidelines, we could reduce the risk of premature death by 63%. We could prevent up to 40% of all cancers. And thankfully, we could reduce greenhouse gas emissions from the food system by 50% and free up 62% of all of farmland globally. That is huge. So what if we decide today to adopt a 100% plant-based or vegan diet? Is it safe? Is it healthy? Is it nutritious? The answers are absolutely yes. We have all the dietetic associations from around the globe, including the British one, telling us that a vegan diet can support healthy living in people of all ages. That's cradle to grave. So this is undisputed. How do we know this? Well, we've got populations around the world termed the blue zones, which were defined by the demographer Dan Buettner, and presented, his research was presented in the National Geographic magazine. He described regions around the world where people live their longest and healthiest lives, and you can read there where these regions are. And this is a picture of a centenary in Okinawa, still living a vital and healthy life, contributing to society. Now, of course, there's more than one aspect of their lifestyles that they share. There's about 9 lifestyle factors that they all share in common, but today's focus is on diet. And when you look here, taken directly from their website, you can see that 95 to 100% of their diet is plant-based. They go wholly on minimally processed plant foods. They have a daily dose of beans. Now, beans is the main source of plant protein, is key to these areas where people live long, healthy lives. Drink water for thirst, snack on nuts, go away from fish, eliminate eggs, slash the sugar, reduce the dairy, retreat from meat. So the healthy planetary diet would fit these criteria. What about more robust data? We have prospective cohort studies. These are data from the Nurses' Health Study and the Health Professionals Follow-Up Study from Harvard University that followed more than 170,000 men and women, pretty much nurses and health professionals, for the best part of 3 decades now. They've looked at the impact of healthy diet alongside other healthy lifestyle factors. So if you think about people who've never smoked, healthy weight, healthy diet, regular physical activity, and moderate rather than excessive alcohol, when you more deeply into the dietary risk factors, they score the diet highly if you consume lots of fruits, vegetables, whole grain, unsaturated fatty acids from plant foods, and omega-3 fats, which can obviously come from plants or fish sources. And a healthy diet is low in processed and red meat, and also in processed foods in general. So what happens after 30 years of a healthy diet and lifestyle? Well, if all you do is adapt your diet to a healthy plant-predominant diet, you can reduce your risk of dying from cancer by 30%, cardiovascular death reduction by 33%. If you have all 5 healthy lifestyle factors, cancer death is reduced by 65% and cardiovascular death by 82%. There is absolutely no pill or procedure we can prescribe that will have these health outcomes. What about the health of vegans? Say we all decide in this room to adopt a vegan diet because it's the most impactful action you can take as an individual to combat the climate and ecological crisis. Would our health be adequate? We have data from the Adventist Health Study 2 in the US, and here in the UK, the EPIC Oxford study, large cohorts followed for decades, and around a third of participants are vegetarian or vegan. So what do we know? Well, just summarising the data briefly, we know that as you remove meat from the diet, or all animal products from the diet, you are more likely to be a healthy weight. So from omnivorous to vegan, BMI back in the normal range. Omnivorous to vegan, you can slash your risk of type 2 diabetes by around 50%. Vegans have a 63% reduced risk of high blood pressure, and hence the DASH diet, that is a therapeutic intervention for people to treat hypertension, was modelled on the vegan and vegetarian diet. And you're much more likely to have a healthy cholesterol. Now, if we're not talking about preventing ill health, we are not going to meet our climate targets, because to reduce the impact of healthcare on the climate, we need to use much, much less of it. What about other populations? I've shown you data from Caucasian populations. Here is the cohort of vegetarian and vegans from Taiwan, the sushi study, nearly over 6,000 participants, of whom a third are vegetarian and vegan. And I've summarised a large number of studies that they've published showing exactly the same. Better control of body weight, lower risk of type 2 diabetes, less fatty liver, less gallstones, less stroke. And I'll come back to medical expenditure because we need to talk about that. Recently published UK data from the UK Biobank has given us another cohort where we can look at the health of people who do not eat meat. And this particular analysis looked at the incidence of cancer in people following a meat-free diet. It lumped together both vegetarians and vegans in the same analysis. And what we showed was that as you remove meat from the diet, you can reduce your risk of cancer by 14%. And for certain cancers like breast cancer, women reduce their risk by 18%, and men reduce their risk of prostate cancer by 31%. So there is no detriment to your health here for removing meat. And if we want to reduce the carbon footprint of the healthcare industry, we need to reduce our reliance on the healthcare system. We need to promote self-reliance of health. And the sushi study showed us that their vegetarian participants used 15% less medical expenditure, and that was from going less to the outpatient department, less medications, than their omnivorous counterparts. So it's a clickbait headline, that article I contributed to. But if you translate that into the NHS, that's £30 billion we can potentially save by adopting a healthy plant-based diet. And now we have proof that this could have helped us reduce the severity of COVID-19 in the UK population. We all are well aware of the famous COVID ZOE study that I'm sure many of us have contributed to. They collected our dietary data up front, and this study analysed 500,000 participants who've contributed to that study and contributed their dietary data, and they showed that a healthy plant-based diet centred around fruits, vegetables, whole grains, beans, nuts and seeds reduced your risk of acquiring COVID-19 by 10% and the severity by 40%. Now, I fully appreciate that diet and lifestyle choices are very much tied into socioeconomic determinants of health. We need to address both. We need to address access, affordability of our healthy foods so that all the population can access this. And this study showed that if we both addressed diet and socioeconomic risk factors that are determining our health outcomes, we could have prevented a third of COVID-19 related deaths. That is huge. Now, the comment that is always put to us as vegans is, well, it's more expensive. Well, it is absolutely not. And now we've got this study from Marco Springman from the Oxford University, who analysed different types of sustainable diets, whether you call it flexitarian, pescatarian, and he analysed the data from 150 countries using food prices at the time from the World Bank's International Comparison Programme. And in high-income countries like the UK, actually adopting a healthy vegan diet would reduce your food bill by a third. So this narrative has now been debunked. It is not more expensive to eat a healthy plant-based diet in the UK. So what is the international consensus when it comes to health? Can we be promoting this type of eating to our patients to live a longer, healthier life? Well, the answer is absolutely yes. This is embedded in international guidelines. So the American College of Cardiology, that is a chapter of the British Society of Cardiology, has published guidelines in 2019 for the primary prevention of cardiovascular disease. They recommend 2 diet patterns, plant-based or Mediterranean. When it comes to consensus on treatment of type 2 diabetes, all patients should strive to attain and maintain an optimal weight through a primarily plant-based meal plan. What about cancer guidelines and my specialty? Well, yes, absolutely. In green you can see, eat a diet rich in whole grains, vegetables, fruits and beans. It says limit red and processed meat. I would say eliminate. There is no health or climate argument to support the consumption of red and processed meat. Processed red meat has been classified as a group 1 carcinogen. It is criminal that we still serve this in our hospitals. We need to change this. And what about national dietary guidelines? Well, they are catching up. I always ask my audience to have a look at the the dietary guidelines from Canada and tell me what they do not see there as a food group that we've been so used to seeing in all our guidelines. But what you can see is that it's very similar to the EAT Lancet Planetary Health Plate. Half fruits and vegetables, quarter whole grains, and a quarter protein. And make water your drink of choice. When it comes to protein, it clearly says for the co-benefits for health and the planet, choose plant sources, beans, nuts, seeds, legumes, pulses. The latest guideline that I found was from Denmark. You can read there, eat plant-rich, varied and not too much. And what about the UK? What are we doing? Well, it was great to read the document from the National Food Strategy. It's a really valuable document, actually. If you haven't read it, I would urge you to. Sadly, for me, the recommendations are slightly watered down because actually to meet the requirements of the Eat Lancet Planetary Health Plate, we would have to slash our meat consumption in the UK by 80%. But you can't argue this is the right direction. We need to promote fruit and vegetable consumption. At the moment, our patients, only 28% of UK citizens are consuming 5 portions of fruits and vegetables. The average fibre consumption is 18 grams when we need to be aiming for more than 30 grams. And of course, our reliance on ultra-processed foods is far too much, and that needs to change. And as vegans, we get fed up of hearing that the diet is restrictive and nutrient deficient. It is far from that. You only have had to have adopted a plant-based diet for a few months to know how abundant it is. The fact is that our global diet is restrictive. 60% of global calories come from 4 plant foods. I wonder if anyone knows what they are. Wheat, rice, soya, maize, 60% of calories. That is not a problem with a plant-based diet, it's a problem with global diets, and that needs to change. But this analysis of 141 studies and a meta-analysis looked at the dietary adequacy of different diet patterns. And you can see vegan, vegetarian and meat eaters, and every diet pattern needs to be planned. Doesn't matter how you choose to eat, you need to make sure you're getting your nutrients, and a plant-based diet is no different. Of course, I would be amiss to not mention vitamin B12, not found in animals or plants, and they're formed by microorganisms. We need to get that from a supplement if we're following a 100% plant-based diet. But in summary, the authors conclude that as plant-based diets are generally better for health and the environment, public health strategies should facilitate the transition to a balanced diet with more diverse, nutrient-dense plant foods. I could not agree more. And if we are really interested in climate justice, climate health, then we need to think about our food choices as a social justice problem for our fellow humans. None of us grew up with the ambition to be a slaughterhouse worker, yet we expect our fellow humans to slaughter those 80 billion land animals every year. This paper is just one of many in the literature just showing the detrimental effects of slaughterhouse working on the individual, the human that has to do it. And COVID-19 highlighted how meatpacking plants were a real sort of centre of COVID-19 outbreaks for reasons that I don't need to explain. But this study highlights once again the mental and physical detrimental effects that this type of work has on, by definition, marginal populations who have absolutely no choice but to turn up to this sort of work every day. Now, you need to invite me back for another talk to talk about the profound health benefits that are up for grabs in treating people with a healthy plant-based diet. But I just thought I would highlight my father's case. So he was 77 in September 2020. Sadly, like many South Asians, he had developed metabolic syndrome. He was overweight. We should be aiming for less than 23 for us South Asians with high risk of visceral fat and type 2 diabetes. His triglycerides were through the roof. He had been diagnosed with pre-diabetes. Now, it was a surprise to me it had taken so long for him to develop pre-diabetes, given that he'd had a Whipple's procedure removing half of his pancreas in 2004. 50% of patients are told they'll become diabetic. And I didn't know whether it was even vaguely possible to reverse the trajectory, but we weren't willing to give up. So he saw my friend and colleague, Rahini Bajekal, who put him on a healthy, culturally appropriate plant-based diet, daily walks, resistant exercise, and within 7 months he's reversed that trajectory and kept there all the way until today. My parents are 79, they eat a healthy plant-based or vegan diet. So I leave you with this. Almost leave you with this. It's time for us to demand a plant-based food system. Our food choices matter. Without addressing food production, we cannot meet our climate targets. Health professionals should be leading by example and supporting patients to make healthier choices that will improve their quality of life and those of future generations. So I hope I've persuaded you that there's a large body of evidence to support plant-based diets for personal and, importantly, planetary health. National and international guidelines have caught up with this evidence, and we cannot think about our personal choices without considering the global planetary health context. So what are my take-home action points? Here we go. Think about your favourite meals and decide how you're going to make them more plant-based. Swap the mince for beans, add in more leafy greens. Decide to take a plant-based challenge. Myself and my colleague LJ Smith at King's College Hospital, whose talk I would urge you to listen to later, running the No Meat May international campaign at King's College Hospital, asking people to ditch meat in May and beyond. Ask your patients about their diet. It's the single most important risk factor leading to their chronic illness and ultimately their premature death. Those online might be able to scan this QRL code. At Plant-Based Health Professionals, we have a 21-day plant-based health challenge free. You can find it on the website. Sign up. You'll get daily emails, fact sheets, videos that will start you on your plant-based journey. It really is not difficult. I hope I've inspired you to learn more. Educating ourselves is the first important step. Take my course at Winchester University. It has fabulous feedback, running for 3 years. It's part of the Greener Impact Toolkit. All of you GPs, you can take it as part of your silver award. And you'll find me at the stall. Come and ask me questions there. I haven't had time for questions in this short half-hour talk today. My first book out on the left is available to buy, but to fill the gap in the healthcare textbook market, we have got an edited textbook just on this topic coming out in September. Thank you very much.